we were blessed that he was working for 20 years with us. I think that we have been blessed having visitors from all over the world, and these numbers continue increasing. More than 80 people came, learned, and they went back to their own countries where they became authorities and promoted the concept of peritoneal dialysis. The International Society for Peritoneal Dialysis started actually as a concept in Guadalajara, Mexico, where Dr. Alessandro Trevino Becerra invited in 1977, invited all the prominent nephrologists to come and discuss their experience. And here you see in this picture, the group picture, you see Dr. Zellerman, myself, a Japanese colleague, Dr. Jack Meyer, who subsequently became the first president of the International Society, Dr. Nolf, and Popovich and Moncrief. So I think that the first unofficial International Society of Nephrology meeting was in Guadalajara, Mexico, at the initiative of Dr. Alessandro Trevino Becerra. The second meeting was in Paris, and there's Baxter organized meeting and produced Marcel Legren, who is not alive now, produced the proceedings, a book that was very important, and there was all the presentations. Here's my then first head nurse and my colleagues and our dietitian and a lot of people who participate from our unit. Now, there were some missed opportunities and biases. I mean, I think that we contributed a lot, but I could not believe that there is place for overnight dialysis with a cycler. And I have to admit that I was very negative because I was so my concept of continuous dialysis without machines was so ingrained in me. When came and proposed to me the idea of continuous overnight dialysis with a cycler as an alternative, I objected to that. And nowadays, I have to admit that more than 50% of my patients are using this treatment, and in some centers, more than 75%. So when a person who is prominent has a biased opinion can influence many other people, and eventually, if the idea is great, I think can overcome that. The other thing is that when the Italians came up with the idea of the twin bag system, which I will say a few words later, I was objecting to that. But the Italians were saying, no, with our technique, we're getting half the rate of peritonitis, one every 24 to 30 patient months, which I was objecting, but I was wrong. And objections to the total disconnect systems. So these are missed opportunities, came across our minds, but I objected. So I want to pay credit to Dr. Umberto Boncristiani, who came to our unit from Perugia, Italy. He noticed the technique. He went back, he couldn't reproduce. He was getting very high peritonitis rates. And he developed this Y-set technique. The Y-set technique is, this is the patient, this is the catheter, and has a little Y-set that between exchanges, he fills that with sodium hypochlorite, Javex, that sterilizes. So when the next exchange happened, he had the bags that had this long tail. He would connect this with that, and the first thing would be, while this is clamped here, would flush the hypochlorite, then he will drain the patient, and then he will run the 2 liters. And he presented, they did a prospective control study that showed that when you compare the rate of peritonitis with the Toronto Western Hospital technique, was 1 every 12 months, the rate of peritonitis with their technique was 1 every 29, 30 months. And for 4 or 5 years, I was objecting to that until eventually we did a study of our own, and indeed we showed that it is true. And since then, it's used now all over the world. It's used in our unit, and our system, the Toronto Western Hospital technique, is now part of history. When we tried, I could not believe that in an open system, when the patients would drain an open system, would really give lower peritonitis rate. But lo and behold, that was true. So nowadays, this is the technique of, instead of course having these bags, they come together, the full bag and the empty bag, they come together, the patient connects, drains, this fills in, and then disconnects. And that was really kind of most of the people now get the peritonitis one every 30 patient months, which is really amazing and very low. Kind of a little bit idea of Greek ancient history. This is how the ancient Greek doctors, the Aesculapius here, the patients offering votives to him and his assistants and the residents and fellows and the nurses. And when I came to Toronto, I thought that this was the way that I should be practiced, the ancient way.